So we can start now. So today is April 30, fast code 21's pre-medical coding, CPC, SDS, AMS, prep session 19, digestive and J system coding. So as we have discussed yesterday, before going to learn any system chapter, we need to know the anatomy of those system. So we will see few anatomy topics here using the image. Then we can go ahead with our question and answers. So digestive system, GI. GI means gastrointestinal system. So our it starts with oral cavity, teeth, tongue, sublingual gland. Here you need to divide this. Sublingual means below the lingual gland. Diaphragm, it will divide the body into two parts, upper diaphragm and downside of the diaphragm, liver, gallbladder, duodenum, ascending colon, cecum, appendix, small intestine, anus. These are all glands, parotid gland, pharynx, submandibular gland. So you need to remember that sub means below. So here submandibular gland means below the mandibular. And esophagus, stomach, common bile duct, pancreas, transverse colon, descending colon, sigmoid colon, rectum and anal canal. So we have all these body parts here. Our GI tract divided into alimentary canal, accessory, digestive organs. And also GI tract is 30 feet long and extends from mouth to anus. So here oral cavity, otherwise we can call it as mouth, mouth to anal canal. So it is 30 feet long. So you need to remember this word as a fresher. So how long is your digestive tract? So you need to tell 30 feet long. And we have large intestine and small intestine. So this is the small intestine. So anus to cecum is the large intestine. Or here we have ileocecal wall. So here at ileocecal wall, small intestine combines with large intestine. So again, large intestine divides into sigmoid colon, descending colon, transverse colon, ascending colon, cecum, and this is appendix. So here, small intestine divides into ileum, jejunum, ileum, and duodenum, jejunum, ileum. So that's why small intestine's ileum, large intestine cecum combines and they will form ileocecal wall. So ileum relates to small intestine, cecum relates to large intestine. So there we have a ileocecal wall which will control the food moving. So I hope this anatomy is very important, as if you could EGD usually call it as esophageal So physician will insert endoscope into the mouth and he will go until the duodenum. Here is the duodenum. So but in colonoscopy, physician will insert scope into the anal canal and he will go up to the ileocecal valve. So because of that reason, you need to know anatomy well for digestive system. So we have some procedure related to gallbladder. Usually we will call it as cholecystectomy. So removal of the gallbladder. So we have stomach. Removal of stomach is gastrectomy. Mostly bariatric surgery purpose. They will remove the stomach. And we have common bile ducts. All this comes under ERCP. So I hope this anatomy is sufficient for you current situation. So now we will go ahead with our session. So but that anatomy is useful. So we need to correlate our question with anatomy part. So now we can start our first question. A 48-year-old patient is admitted to the hospital for chronic cholecystitis, for which a laparoscopic cholecystectomy will be performed. A transverse infraumbilical incision was made, sharply dissecting to the subcutaneous tissue down to the fascia using access under direct vision with a vesiport, and a scope was placed into the abdomen. Three other ports were inserted under direct vision. The fundus of the gallbladder was grasped through the lateral port, where multiple adhesions to the gallbladder were taken down sharply and bluntly. The gallbladder appeared chronically inflamed. Dissection was carried out to the right of this, identifying small cystic duct and artery, which was clamped twice proximally. Once distally and transected, the gallbladder was then taken down from the bed using electrocautery, delivering it into an endobag and removing it from the abdominal cavity with the umbilical port. What CPT and ICD-10 CM codes are reported? So 47564, 47562, 47610, 47600. So here you need to find both CPT as well as ICD. So now it is 928. We can discuss the answer at 933. 932 or 33 based on our answers. So first try to find the keywords here. So whether whatever it is in any system, finding the keyword is very important. So if you are good with ICD, you can find the answer using ICD. If you are good with CPT, you can find the answer using CPT. So that is your capability. So but we need to find the correct answer. So mostly digestive system, if you know the anatomy, we can do very well. Just to analyze the operative report. So what's going on there and try to identify the keywords. You no need to worry about the answer. Anyway, I will explain to you. So if anyone finished answer, just mention in the chat box. So whenever we learn something, we need to learn without any hesitation. We no need to worry about the answer. So you guys no need to worry about the answer. If you don't understand, we will discuss here. Our intention is to help the coders. So you no need to worry about that. If you don't understand, we will discuss after completion of whole chapter, whole session. Sorry, I will try to explain as much as possible. So first try to find the keywords here. Keywords are very important everywhere. So now it is 9:32. We will discuss the answer. So we need to first find the keywords here. I will tell the keywords. Try to remember. So first, as soon as you see any operative report, you need to identify whether it is a open procedure, laparoscopic procedure, or percutaneous procedure. But you need to understand what is the procedure here. So if you see incision in the operative report, you need to think open procedures. And if you see any laparoscope like that, words, you need to think that it's a laparoscopic procedure. So we will check now. So a 48-year-old patient admitted to the hospital for chronic cholecystitis. So what is cholecystitis? It is inflammation of gallbladder. So for which a laparoscopic cholecystectomy will be performed. Okay. This is the description of the procedure here. A transverse infraumbilical incision means below the umbilicus. Incision was made sharply dissecting the subcutaneous tissue down to the fascia using access under direct vision with a Vesiport. This is a one keyword for laparoscopic procedure. So basically in laparoscopic procedures, physician will use ports in order to insert camera. So if you see port in any operative report, it will be laparoscopic procedure. And a scope was placed into the abdomen. Okay. Three other ports were inserted under direct vision. So this is also one keyword. The fundus of the gallbladder was grasped through the lateral port, where multiple adhesions to the gallbladder were taken down sharply and bluntly. So the gallbladder appeared chronically inflamed. That's why initially physician mentioned it as chronic cholecystitis. So inflammation of gallbladder is cholecystitis. So dissection was carried out to the right of this identifying small cystic duct and artery was clipped twice proximally, once distally and transected. So the gallbladder was then taken down from the bed using electrocautery. So this is also one keyword. Delivering it to an endobag and removing it from the abdominal cavity with the umbilical port. Why gallbladder was then taken down from the bed using electrocautery, delivering into an endobag is sometimes what happens, physician will start the procedure and due to some issue with the patient's condition or technical problem, physician may stop the procedure. So if you see the operative report in the heading part or here, if you code, it is a wrong procedure. So whenever you see the operative report, we need to check from starting to end point. So here gallbladder was removed means, so the procedure is physician has performed surgery completely. So we can code direct code here. So whenever you have CPT and ICD, you need to use elimination technique. So here you need to check. Here we have two double codes. So if you check K81.1 and K81.2, you can eliminate two codes here. So what is K81.2? One second. So K81.2 is acute cholecystitis with chronic cholecystitis. So, but based on our documents, we have only chronic cholecystitis. So because of that reason, our answer is K81.2 is wrong. So we can eliminate A and C. So we are left with B and D. So now we need to check the CPT part. So what is 4,7,600? So it is open cholecystectomy. So here, if it is excision, it is a open procedure. So it is open cholecystectomy. But based on our document, it is laparoscopic cholecystectomy. So here we need to choose 47562 and K81.1 as the answer. So 47562 is for, we will check here only directly. See here, laparoscopy. So laparoscopic procedure here, 47562 laparoscopy surgical cholecystectomy. So based on our documentation, physician has performed laparoscopic cholecystectomy. So we need to code B. 47562 is the answer. So we will go ahead with next one. A 61-year-old male who has a history of symptomatic ventral hernia was advised to go undergo laparoscopic evaluation and repair. An incision was made in the epigastrium. So guys, I think it is better you guys read this question and find the answer. Why means in CPC no one will help you to read the question. So you guys read and try to find the answer here. So now it is 9:38. We will discuss the answer at 9:42. So guys, here there is a huge rain. So we may disconnect in the middle. So if we may disconnect, if we disconnect, we will meet in the next session, as here is very huge rain. If it disconnects, we will meet in the next week. So meanwhile, if you have any doubts, please mention in the comment section of any video. So you can write your answer in the chat box. Yeah, that's why lucky. So I am cautioning you before the disconnection, so that you will not try again. So try to find the keywords first. Yeah, no worries, Paramila. We can check the answer. So no worries. So we will start our discussion here. So a 61-year-old male who has a history of symptomatic ventral hernia. So this is patient has ventral hernia and advised to undergo laparoscopic procedure. As I told you before, you need to find whether it is open procedure or laparoscopic procedure. An incision was made in the epigastrium and dissection was carried down through the subcutaneous tissue. So here we have two more keywords like trocars were placed and in the left upper quadrant and the left lower quadrant and the laparoscope was inserted. So this is also keyword, and dissection was carried down to the area of hernia where a small defect was clearly visualized. There was some momentum which was adhered to the hernia and this was delivered back into the peritoneal cavity. The mesh was stacked onto the defect. So we need to find or identify, this is also one keyword. So basically here what happened? Here answer A is wrong. Why means 49560 is a open procedure. But based on our documentation, physician perform laparoscopic procedure. So 49560 is wrong. You can directly eliminate that. And C 495, we will check 49562. I think we may not find this one. If we find it is good. So we don't have 49562. So here 49562 is also correct. But based on CPT guidelines, we will not code mesh along with ventral hernia repair. So that's why we can't find 49562 and sorry 52. Yeah, correct. 495 49652. Yeah, we have the answer. No need to worry. So A is wrong. Why means A is open procedure. And what about C 49653? It is incarcerated or strangulated. So basically, whenever you code hernia repairs, we have whenever you code ICD procedures, ICD CM diagnosis or procedures, we have codes related to reducible, incarcerated or strangulated. But based on our documentation, patient did not mention that it is a incarcerated or strangulated hernia. So we need to consider it as a reducible code. And also we need to find one guideline here that do not report 49652 in conjunction with 49568. But if you check the option D, here 49652 along with 49568 both are wrong. So C is also wrong. Why means C is for incarcerated or strangulated. So because of that reason our answer is 49652. So if the physician did not mention any type of hernia, defaultly we need to think that it is a reducible hernia. So here our answer is 49652. So I hope everyone got this. Yeah, B is correct. So if the physician mentions incarcerated or strangulated hernia, we need to code C. Yeah, C is wrong, B is correct. So read this one and find the answer. So we may disconnect any time. I will try to find the answer here. So now it is 9:46. We will discuss the answer at 9:50. So Parimela, don't get confused. In hernias, we have two types: reducible code as well as incarcerated or strangulated hernia codes. So in order to find these words, you need to check the operator report thoroughly. So 5.3 is for incarcerated hernia, which is not mentioned in the document. So defaultly you need to consider it as a reducible hernia. So find the answer for question number 3 now. So if we disconnect, we will meet next week. Yeah, you are doing good, Paramila, but sometimes you are getting confused. So don't get confused, just to try to find the keywords. So keywords are very important. So if we disconnect now, we can meet next week. So here we will discuss the answer. So here patient has acute appendicitis. So inflammation of appendicitis, operating room anesthesia versus step trocar. So whenever you see trocar, you need to identify that it's a laparoscopic procedure. If you don't find laparoscope word, you need to find using the port or trocar. So it is a laparoscope anyway they have mentioned. So here also they have mentioned trocar, and the window was made in the mesoappendix using blend dissection with no rupture noted. So possible rupture, there is no rupture here. So we can't code rupture code here. The base of the appendix was then divided and placed into the endo catch bag. So with this, physician removed the appendix. So our answer is 44970 here. Why means physician performed the procedure using the laparoscope, not open. So we can eliminate 44950 as it is a open procedure. And also we will eliminate C as it is a open. The surgical procedure performed was an appendectomy, eliminating multiple choice D. So we will check 44950. 950 excision appendectomy means it is open procedure, but based on the procedure physician has performed laparoscopic procedure. So option B is wrong. Next we will check 44960. So 44960 is for ruptured appendix, that is also open procedure. So C is also wrong. We will check 44979. So it is a unlisted laparoscopic procedure. But whenever we have suitable procedure, we will not code unlisted procedure. So we will eliminate D also. So we are left with 44970, which is A. So here our answer is A. Yeah. So read this fourth one and find the answer. Now it is 9:52. We will discuss the answer at 9:56. Yeah, A is correct answer. So as there is no power here, I am doing bit fast. Try to understand. So anytime we may disconnect due to power issue here. So if it disconnects, we will meet next week. Meanwhile, if you have any concerns, please mention in the comment section of any video. I am ready to help. So anyone interested for CPC training? Tomorrow onwards, we are starting one paid CPC training. If anyone interested, please let me know. So it is basically English training. So English medium is the language. So it is approximately 45 days training. So now we will discuss the answer. So a 58-year-old female had a CAT scan which revealed evidence of proximal small bowel obstruction. As we discussed previously, diagnosis is very important for any procedure. So she was taken to the operating room where an elliptical abdominal incision was made, excising the skin and subcutaneous tissue. There were extensive adhesions. So extensive is the keyword here along the entire length of the small bowel. Small bowel or small intestine, both are same. No need to confuse. The omentum and bowel were struck up to the anterior abdominal wall. Time consuming, tedious, and spending an extra hour to lyse the adhesions to free up the entire length of the gastrointestinal tract from the ligament to traits to the ileocolonic anastomosis. The correct CPT code will be option C. So here this procedure was not performed by laparoscopy. So it is an open surgery. Because of that reason, we will eliminate B and D. Yes, 44810. So anyway, we will go directly here. sorry, 180. We need to go back, not front. So it's a laparoscopic procedure. So physician here performed open procedure. So we will directly eliminate B and D. So we are left with double A and C. We will check A and C now. 44005. So we will go up. What is 44005? So enterolysis, freeing up intestinal adhesion separate procedure. So basically here there is a, it is enterolysis means lysis of adhesion. So here physician has performed only lysis of adhesion. So he made freeing of the tissues. And here we have one keyword based on CPT guidelines. If the physician mentions extensive keyword, we need to use the 22 modifier for increased procedural service. So here it is, A is normal lysis of adhesions. So C is